Welcome to HealthWatch, presented by Novant Health, and I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today, we will welcome two new providers who have joined Novant Health Oceanside Family Medicine in Southport, Dr. John Scheck and nurse practitioner Sarah Clagg. Then, Peggy Beverly, manager of surgical services for Novant Health Brunswick Medical Center, will join us to share more information about the surgical offerings at the hospital. Then we'll welcome Dr. Nicholas Bodeenheimer of Novant Health OBGYN with an important message for our viewers who may be pregnant. And finally, Stephanie Haran, Novant Health Brunswick Medical Center's Director of Clinical Improvement, will share information on hospital quality. Stay tuned to learn about valuable health topics with HealthWatch. First, we'll welcome Dr. John Scheck and nurse practitioner Sarah Clagg of Novant Health Oceanside Family Medicine in Southport. Welcome to the show today. It's such a pleasure to have both of you here.
Thank you.
Hi.
You're quite welcome. I want to welcome you to the community first and to Novant Health Oceanside Family Medicine in Southport.
Thank you.
Yes. It's exciting to have you there. And, but I want to start out today by learning a little bit about both of you. So Dr. Scheck, we'll start with you.
Okay, Jen. I basically moved here just a couple months ago. I just started with Novant. It's been very exciting.
Good.
I have a doctorate degree at MD. I went to Ross University. I did my residency up in Alaska, specialized in family practice and wilderness medicine.
Wilderness medicine?
Wilderness medicine.
Okay, I got it.
So that's, it's a story. I also have a master's degree in acupuncture and herbal medicine, and I have a bachelor's in public health.
Great. That's really a varied background, and I'm excited to hear more about the wildlife medicine. But right now, tell me where you came from most recently.
I spent a little bit of time at Onslow Hospital in Jacksonville.
Yes.
And then before that, I was up in Anchorage, Alaska.
Yeah, great, great. Okay, Sarah, it's your turn.
Okay.
So tell me a little bit about you, where you came from, your education, and your background.
Okay. I'm from West Virginia. Lived there all my life until about 8 months ago. Came to this area in anticipation of retirement down the road, just to get here located.
Right.
But as far as my medical background, I did my undergraduate and graduate in at Marshall University in Huntington, West Virginia.
School.
Yeah. So go Herd.
Yeah. I was going to say that.
Yeah. And while I was getting my graduate degree, I worked in intensive care at a hospital, local hospital, until I transitioned to nurse practitioner. So I've been a nurse practitioner for about 15 years.
Oh, wow.
So, and most of it's been in family care.
Yeah. So speaking of nurse practitioner, tell me a little bit about your role as a nurse practitioner at Oceanside Family Medicine in Southport.
Basically, I'm going to be there to help support the physicians with their patients. In other words, we want to expedite getting patients in to get their care if they need it.
Sure.
Like a more urgent, acute setting. So if they call one day and they're ill or they're having some problem with their medications or whatever, if the doctors aren't available because of a full schedule, then I could see them and help take care of that. So we'll all be working closely together for continuity of care. So.
Absolutely. I'm sure they're happy to have you. Now, we've met your partners, Dr. Ty and Dr. Johnson, so I know you have a wonderful office. I know you have a great team down there. But for our viewers who might not be as familiar Can you share a little bit of information about the types of services offered?
Well, basically, it's general family care, which is from newborns to the elderly. You can think of it as general medicine. We do both acute care, where we'll see you for illnesses, as well as chronic diabetes, hypertension, hyperlipidemia, things like that. One thing we do have now is we have open access, where we try to keep a certain percentage of our patient visits open, so that if you're sick, you can actually see your doctor that you would normally have to go to an urgent care for.
Yeah, that's a great thing, to be able to get into the doctor when you actually get sick. And, you know, get in that day. That's really a good thing. Right. And I know you have My Chart, so that also helps with that process, I believe. You can email your physician and or the nurse and let you know what's going on.
Yeah. It's very nice, because not only do they see their labs, but they can follow the trends. Is their blood pressure getting better or worse? Are their labs getting better or worse? So it gives them a pretty complete outlook on that.
And Sarah, I know you said, Dr. Scheck, you said from birth sort of to the grave, practically. So you all see patients of all ages?
Yes.
Is that correct? You all
That's correct.
are comfortable with seeing
We're
children?
family practice, so we see, I mean, we don't do OB in ours, but yes, I see 1 month old and I see 99-year-olds. So.
Wow, that's great.
Yeah.
And what kind of gives you a variety too? It's kind of nice for you all.
It's never boring.
Never boring. So I understand that you all are going to move to a new location very, very soon, and it's called Pine Forest Plantation. So tell me a little bit about that move. How's that going to, are we going to be able to tell? Is it going to be seamless?
Well, that's a good question. Right now we're on House Street down in Oceanside Family Practice, but hopefully the move should be in August. We'll have the facilities complete. We'll be able to see patients when we move, and hopefully it'll be seamless. There won't be much difficulty.
Thank you very much for being here today. It's been a pleasure to have both of you. Welcome to the area.
Thank you very much.
And we hope to have you back real soon, because I want to learn more about wilderness medicine.
Okay.
All righty. Thank you.
Thank you.
Our next guest is Peggy Beverly, Manager of Surgical Services for Novant Health Brunswick Medical Center. Peggy, thank you so much for joining us today.
Well, I'm happy to be here. Thanks for having me.
Well, we're excited to learn more about Novant Health Surgical Services. But first, let's get to know you a little better. So tell me a little bit about your background and your education.
Well, I've been a registered nurse solely in the operating room since the day I graduated from college.
Wow.
So almost 30 years.
Wow, that's great.
And I've been in leadership for surgical services, which includes the operating room, almost 20 years. I've been in a leadership position in several different hospitals.
And your role at Novant Health, that's also in a leadership role. Tell me about that.
My role at Novant Health, the title is Manager of Surgical Services. So as a registered nurse, I actually facilitate the schedule and make sure our patients flow through our surgical services system in an efficient and smooth manner so that they have a good experience.
Right. How long have you been at Novant Health?
6 months.
6 months?
Yes.
Good. So you're still a newbie.
To Novant, yes.
Well, we're really glad to have you. And over the years, we've had many of the surgeons and anesthesiologists from Novant Health Brunswick Medical Center on the show. And today, though, I would like to spend our time talking about surgical services overall. So can you tell me about the kinds of surgical services offered at Novant Health Brunswick Medical Center?
Absolutely. First of all, what comes to mind is total joint replacement because of our population here in Brunswick County.
We're all old.
Yes, and so total joint replacement is, we do total knees, total hips, total shoulders, and do them almost every day of the week.
Right.
The other service offered really to cater to our population, but is cataract surgery.
Oh, yes.
So a lot of those are the same patients, so we get to see them
A couple times. Huh?
a couple times, yes, and they come back because they have such a good experience.
Yeah.
So we also do general surgery and a little bit of spine. We have podiatry and some ENT and GYN.
GYN, yeah.
And then we also do C-sections.
Yeah, that's true.
Yeah.
We think of this as a retirement community. However, there's lots of babies being born at
There
Novant
are.
these
That
days.
business has really grown over
Yeah,
the
it has
year.
really grown. What are some of the most common surgical procedures done at the hospital? I assume it's orthopedics.
Absolutely, orthopedics and total joint replacement. So that's also known as adult reconstruction surgery. So,
Would you think there are any surgical procedures out there that the viewers might be surprised that we do?
plastic surgery we do. Yes,
yeah.
we have Dr. Khan with us.
Yeah,
and,
the new. Yeah.
and he is doing as much plastics as he can at Novant, and it's reconstructive cases for whether it's a cancer patient or for cosmetics, but he does quite a bit of plastic surgery with us.
Yeah, we're lucky to have him. I'm glad he came back to Brunswick County to practice. Since
Absolutely.
He grew up here.
Since there's a history here, yes,
yeah,
absolutely.
really. How about anesthesia? You have on-site anesthesia team, is that correct?
We do. We have 2 anesthesiologists on site and 1 on site after hours, and then we use certified registered nurse anesthetists, which are on our team.
Yeah. Well, some of our past guests have told us about the exceptional quality of care they've received at Novant Health Brunswick Medical Center. Tell our viewers about your team efforts to make sure that happens.
Absolutely. Our team efforts, first of all, are to get to know you.
Yeah, that's
And
nice.
yes, we really want to get to know our patients, and that starts from the day that that patient is scheduled for surgery. Our pre-administration testing nurses will call and set up an appointment either by telephone or in person to get to know your medical background and help put you at ease for surgery. And then it moves from there to the day of your surgery in making sure you have clear instructions for arrival and what your surgical experience might be until you're discharged.
A while back, we were there in your operating room, and we saw the Da Vinci robot, and
yes.
we had Dr. Beninati with us. And so I think that's a really good thing for Novant Health. And I was curious, how might that be used in what types of surgeries?
Sure. The Da Vinci robotic surgery is a fast-growing service for us at Novant, and we offer it through general surgery and also through GYN surgery for hysterectomy, so and for urology. So it's a huge patient satisfier to have that as the patient recovers more quickly in the hospital and gets to go home earlier, and it's just the way of
Yeah, it's the way of the future.
the
now. It
future.
seems like
Absolutely.
Well, this has all been very, very helpful, and unfortunately we're out of time, but before we wrap up, if somebody out there has questions about an upcoming surgery or procedure, how might they go about getting those questions answered?
Well, you certainly can call the number that is posted on Novant Health Brunswick Medical Center's website,
Sure.
and they will channel you to the right
Yeah, if they
area
just call
to
the
have
main
you.
number, they're going to get
Absolutely,
to the
yes.
right person.
Absolutely, they will.
Well, Peggy, it's been a pleasure to have you, getting to know
pleasure
you a
for
little
me.
bit better,
Yes.
and thank you so much for coming today. I look forward to having you back.
Thanks, Jude.
You're welcome. Our next guest is Dr. Nicholas Bodeenheimer of Novant Health OBGYN. Welcome to the show today. It's such a pleasure to have you back.
Hey, thanks. I'm glad to be here.
Good. It seems like you were just here not too long ago, but you always have such interesting things to tell us. And so I'm real happy that you're here today. But the last time you were on, there may have been some viewers out there who missed that episode. So tell me a little bit about your education and your background.
Sure. So my name's Nick Bodeenheimer. I'm originally from High Point, North Carolina. I went to undergraduate college at Gardner-Webb University. From there, I went to graduate school at Creighton University in Omaha, Nebraska. I got my Master's of Science in Anatomy, and then I went to medical school at Virginia College of Osteopathic Medicine up at Virginia Tech.
Wow, that's a mouthful. Yeah. Now, we've had some of your partners on the show before, and that's such a great group. They're always so pleasant and so knowledgeable. But remind us exactly who your partners are and where your offices are located.
Sure. So it's myself, Dr. Toller, Dr. Thompson, Dr. Shue, Dr. McCarthy, and then Sarah Brown's our nurse practitioner. We have our main office in Bolivia right beside the hospital. We also have satellite offices at Carolina Shores, Southport, and Leland.
So you're kind of spread out, you kind of cover
Absolutely.
the county, and that's a great thing because there's babies everywhere. So I understand that you provide a full range of services from babies to menopause. Is that correct?
Absolutely.
Even after menopause, really. So that's great. But today, I would like to speak to you a little bit about a topic that I know that you are very passionate about. It's dehydration during pregnancy.
Absolutely.
And I know that's an important topic for any of our viewers if they're expecting or they know someone who's expecting. So why is it important for a woman to stay hydrated during pregnancy?
So staying hydrated during pregnancy is very important, especially during the second and third trimesters. And here's why.
Okay.
The body's pretty magnificent. When we get dehydrated, the brain releases a hormone called antidiuretic hormone. The purpose of that hormone is to help us retain water.
Oh, wow.
But interestingly enough, there's another hormone released from that exact same area, and it's called oxytocin. Oxytocin is what helps uteruses contract. Also, oxytocin and antidiuretic hormone, they only differ in structure by about 1 amino acid, so they're pretty similar.
Wow.
So when the brain releases a hormone to help us conserve water, also that hormone can be released that causes a uterus to contract. That can lead to preterm labor or preterm contractions. So that's why it's important for women to stay hydrated.
Wow. I had no idea about that, and that's amazing. Well, how much water should a pregnant woman drink?
About 10 to 12 8-ounce glasses of water a day, 2 to 3 liters.
And so you've kind of already told us what the benefits of staying hydrated are, but can you drink too much water?
Not really. And there's other benefits too to staying hydrated. It's going to decrease fatigue, headaches, constipation, hemorrhoids, and urinary tract infections.
Gosh, it's like a cure-all for lots of things.
Kind of.
Well, as we move into summer, what tips would you have for folks, women who are going to be pregnant during those months, other than drinking water?
Be cognizant of how much you're exercising and out in the sun, and how much you're sweating, and try to replenish that water. I hear a lot of patients say, "Oh, I don't really like the taste of water," so sparkling water and flavor additives are okay. I would just recommend being careful about the amount of soda intake and other drinks that have a lot of added sugar and caffeine.
How about all that sodium that's in like caffeine, like drinks, like sodas? There's a lot of sodium in there.
Yeah, there can be, and you want to definitely regulate that amount of intake too.
How about caffeine? Is it okay for a pregnant woman to have caffeine?
Caffeine's okay, but again, you want to definitely regulate how much caffeine. About 200 milligrams a day is the upper limit. And
what does that equate to?
That equates to about 2 cups of coffee.
2 cups of coffee a day. Is that good advice for women who aren't pregnant?
Sure, that's good advice for anybody.
Well, that's good to know. I only have 1 cup of coffee in the morning, so I guess I'm okay. Although I do drink diet soda during the day, so between the sodium and the caffeine, I'm like... Well, that is such great information, and I can tell that you're very passionate about that. And if we need more information about that, how might we go about contacting you?
Our office number is 910-721-4050. Also, you can look us up on our website.
And let's remind our patients about scheduling appointments and what have you. They can just call the main number?
Absolutely. And then if you're already a Novant patient, you can schedule it through the website. And
you just said something earlier off camera about Facebook. I know that you've gotten great reviews on Facebook. So they might want to check you out on Facebook too.
Absolutely.
Wonderful. Well, thanks so much for being here today. It's been so informative. I have learned so much today. And it's always a pleasure to have you. And I hope we'll have you back real soon because you're just full of good info.
It's good to be here. Look forward to being back.
Thank you very much, Dr. Bodeenheimer.
You're welcome.
Our last guest today is Stephanie Haran, Novant Health Brunswick Medical Center's Director of Clinical Improvement. Welcome to the show today, Stephanie. What a pleasure to have you back.
Thank you, June.
Now, I understand you have a new role at the hospital, and I'm really excited to hear about this. But some of our guests may not have seen you before when you were here, and you've been here like 4 times, I think. So tell us about your position now at Novant Health Brunswick Medical Center.
Sure. I'm the Director of Clinical Improvement. And what that entails is I oversee all of clinical improvement in every department in the hospital. I'm actually a corporate employee, so connect a lot of what we do here at Brunswick with our other Novant Health facilities.
Oh, wow, that's a big job.
It is.
Well, how long have you been with the hospital, Stephanie?
It'll be 21 years in June.
So just a little bit longer than me. Yeah, wow. So let's talk about your background.
Sure.
Before you took the role of Director of Clinical Improvement, what was your position?
Well, I'm a registered nurse, and I've been a nurse for 23 years. At the hospital, I've been a nurse in the emergency department, charge nurse. For 10 years, I was the nurse manager of the emergency department, and then 1 year as the nurse manager on med-surg. And then I've been in this position a little over a year.
Well, it sounds like you have extensive experience, and we're certainly happy to have you here today. And today I would like to discuss kind of a complicated topic, and that's hospital quality. So at a basic level, can you tell us what you believe is important that patients learn about hospital quality?
Sure. I really think in the world today, with all the information that we have and all the choice that we have, it's really important for our patients to understand what equates high quality. So it's really important for patients to be aware of where they receive their medical care and what kind of scores those hospitals have or that the doctors have and the reputation to make sure that they are receiving high quality and safe care wherever they go.
Right, right. Well, what types of efforts are in place to ensure the highest level of quality and safety is maintained at Novant Health?
We actually have a lot of different programs that we're involved in. At the facility, we have 2 nurse analysts, and their job basically is to review all of our patients' charts. So they have different quality measures that they go in and look for. So some of the things that we look at, say if you come to the emergency department, we want to make sure if you're having chest pain, we need to get an EKG within 3 minutes. We need to make sure that we identify if you are having some kind of chest issue or if you're having an acute heart attack, we need to get you shipped to a higher level of care within 30 minutes. So those are some of the quality measures that we look. We also look, which is important right now, coming off of the flu season, we want to make sure that all of our patients have had their flu shots. So they want to check, and they check every single patient that comes in that's admitted to ensure that they have that done. So there's certain measures that we look, and what's really great for our patients is they can then go online and they can see where we score. So they're going to take a look at our patients, change that to a percentage to see how much we're compliant, and our patients can actually see how we score out and how well that we do.
Well, that's great to hear, and because I think that knowing the quality is very important for all of us individually. So the next step then, I guess, is finding that data and accessing that information on hospital quality. So what sources do you recommend?
Hospital Compare is a really nice resource to be able to go to, and when you look at that, you can pull up our facility separate, and you can also compare us with all of the surrounding facilities in our area. And it looks at a lot of different things when you go to Hospital Quality or when you go to Hospital Compare. And one of the things that also is connected to that is called Leapfrog, and the Leapfrog scores, it's kind of like school. So you're looking at scores from A to an F. So of course you want to have an A, and an A means that you meet the highest standards, highest quality, that you meet all the measures. Some of the things that they look at for that is maternity care. They also look at readmissions. So for some of the diagnoses that we have, such as congestive heart failure, chronic obstructive pulmonary disease, or pneumonia, we want to make sure that we're providing the right care at the right time, and then also make sure that our patients have the resources that they need at home. So they look at our readmission rate for some of those pieces. So Leapfrog actually gives you information on that, as well as how well do we provide medication, how well do we look at your medication and make sure that you're on the right thing. So what's really nice is it's really easy to look at because you'll get a grade, and I'm really happy to say that we're an A. We've had an A grade. This is our third time. The grades just got released this April. But it's a nice way to be able to look and compare to see where we are against the other facilities in our community.
So we can go directly to Leapfrog?
Yes.
Is it like leapfrog.com?
.org.
.org?
It is.
Okay. And so we'd be able to see all that information.
Yes.
And that's the source that you would recommend?
Yes.
Great. And tell me a little bit more about the data that you would see on the sites. And is it easy to read? And
It is, and there's actually two different ways that you can look at. One has little bars, so if it's 4, it means that we're highly successful, that we meet all the standards. And the other one kind of gives you a gauge, kind of like on your car, and it has a red, a yellow, and a green.
Oh, okay.
So the red, obviously, we're not doing very well. The green, you're doing very well. So both of those sites will give you the same scores.
Good.
And it will let you know where we are with quality, with our safety issues, with our readmissions, and gives you an idea of how our hospital compares.
oh, that's awesome. How do those organizations collect that data? Do you provide it to them, or do they, how does that work?
It's a little bit of both. We actually, I'm involved with the Leapfrog scores, and I actually help to fill out the surveys. We do that twice a year, and that's from our information that we collect at the hospital. Everything is validated to make sure that it is correct and we're providing the right information.
Right.
The other thing that they do is we also provide all of our scores. It's publicly reported, most of our quality scores online, and also from Medicare and Medicaid, from CMS. So they actually take some of that information, as well as our patient satisfaction scores, because patient satisfaction scores are very important too, to see what our patients think about us and how our families would recommend us.
Right. So it comes from that data comes from various sources, and then they compile it and offer it back to us. That's great. This has been incredibly helpful. I can't tell you, I've learned so much today. And we hear from many of our guests that have been on our show that Brunswick Novant Medical Center has received several quality awards and recognitions, as well as certifications. Can you tell me a little bit about that?
Oh, sure. In the past year alone, we've had the Better Business Award. We have also had 2 gold awards from the American Heart Association. And so one is for our heart care and the other is for our stroke care.
Nice.
So having the gold award is great recognition from that group. We also have recognition for our radiology group and also for our respiratory care. So we've done very, very well this year and worked very hard to make sure that we provide excellent quality of care for our patients.
Sounds like it. Well, I know that we could probably go on and on about this topic for days, but our time has run out. So I do want to thank you for joining us today. As always, it's a pleasure to have you. Looking forward to the 5th time on the show. Once you've been in the job a little while, I'd be happy to have you back and see how that's going.
That'd be great, June. Thank you.
Thank you very much, Stephanie. Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.com. Visit NovantHealth.org for more information on Novant Health Brunswick Medical Center, local doctors, and general health information. Thanks again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.
Join Novant Health Urology in Charlotte for their open house and ribbon cutting June 20th.
When you build a bundle with ATMC, you have options. More than 100, actually. You can pick the perfect combination of high-speed internet, digital cable, reliable home phone, and ATMC security with smart home solutions, which means you can get a whole lot of this, with more of this, a bit of that, and maybe even some of this and this. The options are yours. So build your bundle today and save with ATMC.
ATMC Security is changing the way you connect with your home, making it safer, smarter, and more efficient. Now you can manage your home wherever you are with a single app. Lights, locks, thermostats, 24-hour security monitoring, and more, which means you always come back to a safe, comfortable home. Monitoring services start as low as $17.95 per month. Make your home a smart home with ATMC Security.